So take a moment to reflect on this question. What's something people often don't see in your role or the clients? Take a moment to reflect on this question. What's something people often don't see in your role or the clients? Huge apologies. Actually, I realized that there was the mic was muted, and I'm really sorry about that. So just to actually get through the few slides at the start, um, I'm Dr. Devi Sundar, integrated mind body consultant and a founder of Teletherapies and Mind Body Synergy, CIC. So this webinar is focused on the trauma everyday practice of trauma informed approaches. And this is more focused on the clinicians and healthcare professionals and community practitioners who are dealing with their daily care. And it also applies to the employments like the workplaces and where we are interacting with humans. So this is something which is a generic and more focused on how we can incorporate trauma informed approaches in our daily everyday practices. So you can see a bit of my qualifications, what I trained in on the slide, and with my 23 years of experience and certified in complex PTSD, I felt the need to deliver the session so that our care packages are incorporated with the trauma-informed approaches for our patients. So you would have actually reflected on this question earlier. I'm just running through the slides because I realized that the mic was mute earlier. So let me run through further. So this slide is all about that we are judging our patients just by their symptoms. So that goes along with a famous saying there, don't judge the book by its cover. So we always actually interact with the patients based on the symptoms and missing a huge chunk of their psychological and their life experiences, which interact with their conditions on a daily basis. So what we are not seeing inside the patients are their childhood experiences. And many of us, in some forms of shapes, would have experienced some traumas in our childhood. And it can be one or two or more than three adverse childhood experiences. When I say adverse childhood experiences, I'm focusing on any abuses or neglect or discrimination or poverty. And those are some of the things which I'm pointing out when I'm pointing out the adverse childhood experience and discrimination, which usually plays in many of our roles and also many of our lives as well. So those are something which we are missing when we are interacting with a person at workplaces or when we are interacting with our patients on a daily care delivery basis. So that's something we have to be aware of. And this training is going to bring that awareness of what are the traumas or the responses we are missing to recognize in our patient population or with a human we are interacting with on a daily basis. So you'll get an idea of that. And also some of the principles of trauma informed approaches and how it is going to improve our care. And this webinar is more focused on the clinical population, the healthcare practitioners, the community practitioners, and or if you're a carer or for a patient or a patient watching this, you can actually understand some of the concepts here which is spoken, but there's more focus on the clinical population to get an understanding of how we can use the trauma-informed approaches in our services. So my story of understanding this trauma concept came from my experience of over 23 years interacting with the chronic respiratory disease population. Majority of the chronic respiratory disease population who I interacted with was having multiple other comorbidities like diabetes, IBS, and heart disease. And so it gave me a picture that they are not actually only coming with the chronic respiratory disease, they don't have only the breathing issues, but also they have other comorbidities alongside with it. And frequently there is emergency visits, and people end up in the hospital corridors with their breathlessness and alongside with other symptoms as well. So when we are talking about this scenario, and I was thinking about like why this treatment was working, and what is that people are talking about their anxiety and why are they panicking frequently and getting more breathless. And the research also confirms that more than 40% of people with chronic respiratory disease have the anxiety and depression. And people, when I'm delivering the rehab program to them in my past experiences, would talk about their daily lives, their interaction with their daughters or the sons, and how that impacted their breathing. And when I'm connecting the dots and also alongside looking at the research evidences, the adverse childhood experiences, some of them which we're discussing, and their daily interactions, which surface their adverse childhood experience in their families, also impacted how they are engaging with the services and the care they are consuming from the healthcare services. So there is a huge frustration on both sides for the patients that they are not engaging the services because they're not finding value in the services, and demotivated because they have this anxiety and depression, which push them into a shutdown mode. And the healthcare professionals, on the other hand, are also more frustrated because why patients are not coming, why again and again, if I'm saying the patient to take this medication, the patient is not taking, why again and again when I say this particular exercises or the self-management routine is going to help them, they are not listening to me. So there's a huge frustration on both sides and a huge burnout. And this webinar is all focused on why, to answer that question, why is this happening? And what are we missing in our care on a daily basis? And also, this is not only going to apply this training to apply to the healthcare delivery, but also on a daily basis in interaction with the work colleague or workplaces, organizations, where trauma-informed approach is required in the interaction. So you'll be getting more understanding as I run through the slides. So I'm just running back again these slides because there was no voice. It was muted earlier. So as I mentioned earlier, so I got a realization that there is a huge role of the adverse childhood experience in the patients, and that surfaced in their clinical encounter. And they had more than one of their adverse childhood experience and more than three of childhood experiences. So when I talk about the adverse childhood experiences, focusing on that abuse, neglect, and discrimination or poverty, this is something which is actually ingrained in the childhood, and we think that as they grow up into adult, that's not going to affect them any longer. But that is not the reality which is happening inside our body, because the same body which has all the organs, the mind actually is there. The mind is a director of the functioning of our the organ systems inside you, and the mind is connected to the nervous system to activate all the functioning. So if the mind is actually registering these traumas inside us, and that is not helping the nervous system to activate in the right way. So these are some of the learnings I understood from my practice and also other trainings what I've received during my years of professional experience. So, excuse me. And so this hidden link is something which we are missing in our examination rooms or in the rehabilitation rooms, where we deliver the care to the people, and also in our workplaces where we're interacting with other colleagues and modeling their career journey growth packages in the workplaces. So we are missing this huge gap. So, to go in depth, then I went back and understood what is exactly the numbers. More of a number person myself. I wanted the data to understand, is it really true? Is it really the adverse childhood experience going to affect the people? So, the numbers, as you see in the slide, there's a 5.4% of increased odds. And for the people with asthma, per unit increase in their adverse childhood experience scores. And this is the data from the US adults in 2024. And there was 31% of higher likelihood of asthma symptoms increasing if there is three or more of the adverse childhood experiences in the patient. And there was also a landmark study, it's 2024, which confirmed what clinicians were beginning to suspect, that is the childhood adversity, that is the experience of abuse, neglect, or discrimination, poverty. Those experiences in the childhood had a increased ratio of their adult respiratory disease, and creating a dose response relationship between the early trauma and the later illnesses. So this is a very key important study which actually helps us to understand, hang on a second, my patients is not only representing the symptoms, and they are representing their life experience in front of me, which is interacting with their symptoms and also determining how well they are interacting with my care. So we can see when the patient is coming to us only the symptoms, and we cannot see the invisible scars of the trauma which created inside them, which is having a huge impact on the lungs, the immune system, and the nervous system that can last for a lifetime. And there is also studies in China, that is in a study in the 2025, which actually reveals that individuals with four or more of adverse childhood experience have a 48% higher likelihood of their developing chronic respiratory disease. And a universal pattern also follows across the population, the culture, the healthcare system, that links the childhood adversity and the respiratory disease. So adverse childhood experience is a global health issue and not a regional anomaly. So now, going back to the question, what's something people often don't say in your role or clients? So that's something which I want you to take a moment to reflect. So you can write it down on a piece of paper, or you can use a chat box to share what's something people often don't say in your role or client. And this is a very important question to think about, because we invest our own training and knowledge into people's care, but we get at the same time frustrated, the compassionate fatigue, and the burnout, because we see the patients are not engaging, or people in the workplace not engaging with us. So what's something people often don't see in your role or the clients? Okay, let's move on to the next slide. So, after reflecting that particular question, very important question as well, today my session is all about trauma informed care in everyday practice. And I'm not going to deliver something a specialist intervention, although you're going to learn some of the strategies and principles of trauma informed care in this session. But it is more focused on how we can reform the way of working, what we can do differently in real practical ways in our daily interaction with people, whether it's a patient, whether it's a client in your workplace. That's how practically we can incorporate this trauma informed care in our daily practices. That's all about in this webinar you're going to learn. So before I could go further down, I wanted to actually clarify between these two terms, trauma-informed and trauma-focused, because many of the therapy services who are dealing with complex PTSD or trauma, they label them as a trauma-focused, which directly treats PTSD and the trauma symptoms. It is particularly more into the clinical interventions or the therapies, what they deliver. But if we put a question, are they using a trauma-informed approach? Some of them would actually lack that integration in their practice if they are even using the trauma-focused intervention. So the trauma-informed approaches is shaping how all care is delivered, regardless of the diagnosis or the setting. Okay, so because many of our behaviors are coming from our mind, and people with anxiety, depression are more prone to the substance abuse. They use higher rates of drugs or cigarettes or any other forms of alcohol. These substance use disorders actually are stemming from their behavioral issues. And chronic pain, they are running away from chronic pain of either a physical pain or an emotional pain, and leading them to isolation or avoidance from the reality of their lives. And this is actually then shutting them down to adapt to the threat. And it is not the character flaws or the problems we have to focus. It is actually why they are shutting down. That is something we have to understand, because trauma is often invisible, but it powerfully shapes their engagement, trust, and behavior with the interaction of their daily lives, in their daily lives, with the people, with the care services and everything. So what I wanted you to focus here is all trauma-focused interventions are not actually using the trauma-informed approaches in their practices. So what is it actually trauma-informed approach is something which we are going to actually learn in this webinar. So by the end of the session, then I would be more happy if I achieve these goals and I'm able to deliver that you're able to understand the principles of trauma-informed care and its relevance in the everyday practice, and recognize trauma and its neurobiological impact on the behavior and the health, and reframe behaviors as adaptive survival responses and respond using trauma-informed principles, and apply practical strategies to support regulation, safety, and professional well-being. So the important question, why it matters. I earlier actually revealed that how I got interested into this trauma-informed approach through my respiratory care practice and dealing with people with chronic respiratory disease and what the evidences say. But also there is a wider picture beyond the respiratory disease. Trauma is not only in the respiratory disease, but it is actually leading to many other chronic conditions, and is a result to their unresolved trauma experience in their childhood or along their journey in their adulthood. So that leads to their substance abuse as a coping mechanism, and chronic pain, obesity, and disengagement with the care. And many behaviors that appear as a problem, or in fact, their adaptation to the threat survival strategies, that is, make them a little bit of sense, because when they're dealing with a huge amount of trauma, and the sensation of the pain, which is unexplainable by them, they wanted to not engage with the pain, and they avoid the pain and run away using other coping mechanism, which is having a negative impact, like substance abuse or overeating, binge eating, and other addictive behaviors. So I want you to now understand, what is trauma. Trauma is nothing but an event which is happening in their childhood, like an abuse or neglect, and discrimination or poverty, and the experience which the brain is making sense of, having a lasting impact on their nervous system. So it is actually not the inability to forget. It is a failure to, sorry, it is the inability to forget, not the failure to remember. So they actually are retrieving those memories, and where your brain regions, especially the hippocampus, are turning that short-term memory into a long-term memory linked to that pain and the experience and the perception of that experience. And the complex PTSD is developed from the repeated and prolonged exposure of this interpersonal trauma, including the childhood abuse, whether it's emotional, physical, or sexual, or neglect, or domestic violence, or threat to death, or chronic stress, which most of us are operating on a chronic stress mode now. And which, when we quietly sit and reflect back, this chronic stress is also linked to how we have perceived similar experiences in our childhood, and poverty and discrimination. So these are all, when they are repeated, that builds up this chronic post-traumatic stress disorder, PTSD. So trauma lives in our body and nervous system, and not only in our conscious memory. So it's not something which is just in our brain, because it is interacting with our nervous system, which is helping our body to operate in a way we behave in our daily lives. So, to give you a bit of data around the post-traumatic stress disorder, women are more likely, 2 to 3 times more likely to develop the PTSD, post-traumatic stress disorder, than men. And they also confirmed 1 in 3, there is globally, women experiences physical or sexual violence. Data, particularly from UK, 1 in 4 women experiences domestic abuse. And 50% of the PTSD symptoms are about their the childhood experiences, or the domestic abuse, whatever it is, which can be linked to or their childhood experience as well. So the 50% of them are more into this post-traumatic stress disorder symptoms, because of the abuse from which they have survived. And they also, when they are surviving with this, they actually, in a daily interaction with their workplaces, or with their healthcare services, or any other forms of their interaction in their lives, they are bringing up these memories, which is not helping them to shape the behavior in a positive way. So, giving you a picture what really happens when your brain is under threat. And this is the neurobiology of our trauma. So, when there is a threat, we have this thinking brain, which is the prefrontal cortex, that is more responsible for the reasoning, or the fear regulation. And that particular part of the brain becomes underactive when this trauma, one time you experience a trauma, and the brain actually responds in a way, fight or flight, where, because your amygdala, which is a threat alarm center, is overactive at the initial trauma thing, and it sends your body into a fight or flight, or the freeze response. And this is then, the memory is stored in the hippocampus. When this trauma then repeatedly happens, when the trauma is actually, when a person is repeatedly experiencing in one or the other ways, like poverty, discrimination, or abuse again during their later life. And this becomes into a complex PTSD, yeah, post-traumatic stress disorder. And it is not about the event that happened at the time, it is the memory of that event that is building up in your nervous system. And the hippocampus converts that repeated threat into a long-term implicit memory. And your stress hormones each time is actually increasing, and that reduces your neural connection. The neuronal structures are not making new connections. But thanks to our neuroplasticity, we can change this. The brain can heal and recognize the time and right support. So I want you to understand how trauma is stored and recalled in our bodies. And you can remember the famous book, Body Keeps the Score, by Van Bessel Van. And he actually have spoken a lot in his book, and it'll be a really interesting book if you have not read before. So our traumatic experiences are more implicit, and it is stored in our body in the forms of body sensations, emotional states, and implicit memories. And when you actually experience something traumatic in the past, And that is actually staying in our memory with the hippocampus registering it as a long-term memory. And the individual encounters similar kind of, because our brain scans the safety around us every time, whether we are safe, whether we are included. And so we are detecting, our brain is actually detecting the safety signals. When the trauma appears again in some shapes or forms in our lives later, then the individual actually reacts to it rather than responding to it in a more positive way. So after reaction, then they say often, I don't know why I reacted like this. And so the trauma is actually already ingrained in our nervous system, which is not healed properly. And this is activated by some cues in our daily interactions. And then the person actually reacts to it. So the trauma response is what I'm talking here is about intense emotions, fear, shame, rage, and intrusive thoughts or urges, and physical sensations like pain, numbness, dizziness, and impulses to fight, flee, or shut down as a result of these interactions on our daily lives, and also end up in relationships and attachment difficulties. So these are occurring because they are actually, the brain is designed actually to protect us. So our brain is thinking this is a protective mechanism and for survival adaptation. And but what is really happening inside is our nervous system have registered this traumatic experience, which has not been regulated in a healthy way. So that's something which we are going to learn. What is that trauma informed approach? We can regulate our nervous system. What we can incorporate in our practice, if you're a healthcare professional or in the organization structure, what we can incorporate a trauma informed approach to deal with our employees or the clients. And when we talk about the trauma, when a person having these adverse childhood experiences or the traumas repeatedly in their lives, they operate in two zones mainly, either hyperarousal or hypoarousal. The hyperarousal, that is the anxiety or the anger impulsivity, is because the system is actually shut down and locked up in that because they have experienced this experience in the earlier part of their life, and they know the response was going to be, and the brain actually hyper reactive to their experience even without recognizing what is actually really happening in the reality. So your nervous system is stuck in that hyperarousal and reacts with anxiety, anger, or impulsivity to thinking that it's protecting you. And on the other side, what the people with trauma is operating is hypoarousal, is the numbness, shutdown, and dissociation. The system is collapsed, and nervous system actually operates in a lower zone mode and shutdown mode. And because the experiences in the past with the trauma is going to end up in a negative experience, and that's what they have registered in their nervous system and the brain. And so the system operates hyperarousal. Yeah. And what, as a healthcare professional, if you're in a therapy world or in a psychological world or even other healthcare professionals who are delivering services to the cardiorespiratory, musculoskeletal, or any other forms of healthcare services, you have to understand that how you can incorporate a informed approach to bring that person to the window of tolerance where they can optimally function and regulate in the present moment. And that is the main goal of, should be the main goal of any of the people who are dealing with the people in their daily life. Because as I mentioned earlier, as humans, we might have trauma in some shapes or forms. Our brain is making sense of trauma in, if you have not had any of the early childhood experience in the present world of your adulthood, is making sense of trauma because your brain is scanning for danger. And if some danger is happening, then that's going to be registered as a trauma. So you need to be very sensitive in how you're interacting with your patients, with your clients, or your employees in a window of tolerance, and how you can incorporate this trauma informed approach in your practice. So I want you to take a moment and reflect on, how do you know when you're stressed or overwhelmed? Because as humans, we all have our responses, how we respond to stress, whether we react to stress or we respond to stress. And there is a huge difference between reacting and responding to stress. So I want you to take a moment and think about, how do you know when you're stressed or overwhelmed? Because awareness is a key in order to regulate ourselves in a healthy way. So let's give 30 seconds for this. Okay, let's actually move on to the next slide. With the background being in the neurobiology so far of the trauma and how we are going to shape our trauma informed care is going to be the next level of conversation here. So, in terms of a guide, when I talk about a guide to a healthcare professional, there's the four principles foundation, basic foundation, apart from the six principles which I'm going to talk later. So the four basic foundation of trauma informed care which you can incorporate is first understanding the key principles of the trauma informed care, and to recognize, secondly, the trauma responses in our everyday setting. Third, to foster that safety, choice, and collaboration. And fourth is to sustain boundaries and in our daily interaction with humans, and also the practitioner well-being as well. If you're a practitioner, setting boundaries with your clients and yourself. So these are the four foundation. I want to leave this slide for a second for you to register. Now, so in our practice, when a client or if you're interacting in a work setting, and if you're aware the person has a trauma already, and this is very essential that in order to reframe their behavior, the important question is not what is wrong with you, because it's when you start asking what is wrong with you, that is actually triggering their trauma, and also puts them in a light that they are wrong in some way and the behaviors is wrong. But instead the question should be shaped is what happened to you. So when you start asking this question of what happened to you, they are going to open up the space and they are not going to blame themselves anymore or feel themselves more bad, but instead going to reflect back and also talk to you with a less shame and guilt that what happened to them. And also during the interaction and the tone and the conversation of this questioning is very key. So if you're actually having a tone which is not compassionate, which is not interested in the person you're talking with, is not going to help you to gain their open space or sharing of their what happened to them. So it is about how you actually make the space more safe and engaging, and also more curious to know about them from a place where you're going to help them. If they sense that you're not going to help them, they're not going to share anything with you. So it is something that if you're prepared to help them, that is the main important thing which you need to ask. Am I able to help this person? And then you start asking these questions to them. And in a therapy setting, it is very key that the therapist actually follows this, that the framework of questioning, and how you're questioning your clients and helping them with open-ended questions rather than to get them shut down with a closed-end question, or triggering their traumas again and rehurting their emotions and their nervous system. So now I want you to take a moment. What's the behavior in your setting that's often labeled difficult? This very, very important question I want you to think about. Again, 30 seconds. What's a behavior in your setting that's often labeled difficult? Okay, let's move on to the next slide. So now talking about the principles of trauma-informed care. So there are 6 principles of trauma-informed care, as you can see on the slide. And this is very, very key to follow the 6 principles of trauma-informed care, whichever practices, whether in healthcare setting or any other organization on a daily interaction with the clients or patients. So this is first one is the safety. So safety is not only creating the safe and warm space of the room, it is also creating that psychological safety to your clients or your patients. And the psychological safety comes with integrity, how integrate you are in getting that safety, psychological safety to your clients or your patient. And so that is linked to the second principle, the trust, how transparent, for example, in the workplaces, decisions are made, and how there is actually a trust between a therapist and a patient, or a doctor and a patient. Is there any dynamics, power dynamics playing between their roles, and whether there is any consistent boundaries being set between those two groups interacting? So trust is very key in order for the person to engage with the care or the services. And third is the peer support. Yeah, the shared experiences as peers, what we actually share with each other, and with the interest in the other person's growth, instead of being selfish to their own needs or manipulating for their own needs, it's not going to create the space. This more plays in the workplaces with the workplace bullying and those environments. And when it comes to the healthcare, where is actually the funding coming from? Where is actually the program protocols coming from? Who's designing this? And how is the peers are able to understand what is actually going to be the outcome of this program? And how well the peer can invest their knowledge, whether the peers have a say in modifying the healthcare outcome, what they're investing in. So this is actually very key in order for a trauma-informed approach in the care. So shared experience as a part of to healing. And to remember that as humans, whether you're a staff or a client or a patient, we all have this trauma. And I'm talking about, to remind you, it's not only what we are delivering to other people, it's also about you, about how you're engaging in the trauma-informed approach. And the fourth principle is the collaboration, the power sharing, as I mentioned earlier, which also linked to the trust. And so, how the power play is between a doctor and a patient, admin, and the leadership roles in the organization, and how the decisions are made jointly, whether there is any engagement or say or feedback from the employees or feedback from the patients. And this all actually counts for a collaborative approach. And number 5 is the empowerment, how you restore the voices and choices and control. So empowerment comes with choice, and the person should be given a choice rather than having a one fixed generic way. For example, in the rehabilitation setting, we deliver breathing for people, breathing exercise for people. And earlier in my practice, more so in the rehabilitation setting, more focused on people's diaphragmatic and pursed breathing. And people actually, pursed breathing, something a person with emphysema, one of the chronic respiratory disease, they can actually get into that pose, leaning forward and pursing through the lips and breathing out. And teaching that technique to the patients is not making them any sense of engagement into the program. So instead, the person should be made aware of what is actually is helping them with this personal breathing, how other alternative forms of breathing can help them in order to recover from their breathlessness, and whether they have found out any other alternative ways which they can bring in to the care, which can they can share with the other patients in their groups, that can benefit them, being a patient ambassador. So choices and voices matters in gaining that empowerment. And sorry. And the final sixth principle is the cultural awareness. So people are from different regions, different culture, different ethnicity, and their identity matters. So recognizing the identity, the context, and the lived experiences. For example, people in minority groups have a higher rates of adverse childhood experiences in the research evidences, and people with lower income groups have a higher adverse childhood experiences. So when they are coming into the care or when they're coming into the organization, the work setting, the cultural awareness is very, very key in order to deliver a care and engagement of that person or the groups into whatever the organization goals and missions are, or the healthcare program goals and missions are to deliver. So the focus here should be whole person care. So a person's symptoms only should not be considered. It is their life experience, their mental health, their social context, all together should be considered when a care is delivered to a person in the form of healthcare or in the form of employment or in the form of any other forms of care, what you're delivering to the people on a daily life. So when we talk about now, moving on to how is trauma treatment is actually going to help the people, there are three stages of trauma treatment which we need to focus on. Number one stage is safety and stabilization. So this is more focused on the therapeutic setting when your patient or a client is coming to you with a complex PTSD or any of the traumas, depression or anxiety. You need to actually understand the patient's what is their life experiences, and the deep questioning and the way of questioning, how you're putting your question to make them to open up with the engagement with the therapy is very, very important. So the therapist and the client relationship is a key in order to engage the client in the services. So build a therapeutic relationship that can develop this regulation skills inside. Because earlier, when we talked about where these people with trauma operate is an hyperarousal and hypoarousal, these are the two states they operate with. So to bring them back into that window of tolerance space, we need to help them to develop that regulation skills. So establishing a sense of internal and external safety. And stage two is to process their trauma, which is a very key part of this work of trauma-informed approach will need to be followed. So working through the traumatic material safely within that window of tolerance using evidence-based approaches. I'll be discussing later what are those. But so for now, the second stage is trauma processing. And third stage is integration. So rebuilding their identity, the process, how to process their grief and loss, and cultivate resilience and connection. So these are three stages of treatment for trauma if you're a therapist working in the trauma practice. Now, looking at the three stages, how we're going to apply. And so our mind actually have a top down and a bottom up approaches. So whenever there is anxiety and there is a panic or fear, we discussed about an earlier slide about the neurobiology of our brain. Our prefrontal cortex shut down and amygdala, the limbic system is overactive, and hippocampus then actually so works in retrieving that into our long-term memories and impacting our neuronal structure as well. So that is actually the top-down part of it. So the thinking part is all shut down, and but when the person is shut down, the thinking process, we need to activate the bottom up. What is that they can actually from external senses that they can send signals to the brain to reactivate. So we need to not only focus on the top down or only on the bottom up, we need to integrate both of them. So both the cognitive and the somatic pathways is very, very important in effective trauma treatment. So top-down methods are some of the them I've listed here as the psychoeducation. So understanding the trauma impact. So make the client to understand the trauma impact, and then the cognitive strategies and how to develop their skills to reframe and meaning making of their trauma and how they can actually be in the present moment with the mindfulness. And the bottom up is about the body awareness, noticing their physical sensation and the movement, bodily movement, somatic breath works, or any other forms, dance or exercise activity. So movement is very important so that they start to store tension and somatic release processing through their physical experience. So this is very key that we focus on this part along with their top down. So it's not about going to the talking therapies or sitting with your therapist talking only. It is about integrating these two methods in order to have an effective outcome from your trauma treatment. So, the role of a practitioner in the setting, more focused to the healthcare professionals, therapists or clinicians or the community practitioner, the trauma informed practice is more than just listening to the client or your patient. It is about taking a more active guiding role. So, you have to deliver material or education material that is actually not pointing towards the trauma, triggering the trauma again and again, but to able to understand why in the first place the trauma happened and your mind perceived that as a trauma, and what is actually really happening inside the brain, the neurobiological um, uh, um, process which is happening in your brain. And so you're naming the process and reducing that mystery and shame to the person, the client, or the patient, and also to co-regulate the emotions first. So make them understand why these reactions are coming, their rage, their shame, whatever they built up through those experiences, why it is coming and how it is influencing their nervous system. So having that whole person approach, taking their life experience, the mental health context, and also the social context is key in your practice. If you're a practitioner in the trauma practice, where, as I already mentioned, if you're using a trauma focused approach, incorporating a trauma informed approach is very, very key. And also, this applies to any other settings, even if you're not as a trauma practitioner, but you're a therapist and people are coming to you with anxiety or depression. Incorporating a trauma informed approach helps your clients to engage. And if you're any other healthcare services outside the mental health, it's a very, very key. If you're a doctor or an occupational therapist or a physiotherapist, whoever your titles may be, if you're interacting with a human in your care, it's very key that you understand the trauma informed approach and taking consideration of the whole person approach and not only ticking off the boxes of your job. For example, a physiotherapist just doing the exercise and there you go, the patient sending off them to the home. So it is very key that we focus on the whole person approach. So identifying the triggers now. So considering their situation, the environmental cues, the settings, and also the emotions. What are the emotions they are reacting to, and also how their relationships in their lives are working, and how they are developing your relationship. And these are the key foundation of the self awareness. So it is the first step that what are the triggers of my client or the patient, and that will help you to build a structured treatment approach to your patient. So, psychoeducation, as I mentioned earlier, it is about getting your knowledge into practice to the people you're treating or engaging with. And in my channel, Breathe and Thrive, I have actually populated a lot of public education around the mental health and the behaviors and how people should deliver the public health information to people with chronic lung disease and mental health. So you can watch after this webinar, can take a deeper look on the videos. So it is about how you make sense of your knowledge to communicate with the public and help them to understand what they are going through, what is their condition, and what is happening inside them. And especially, this is very important in a trauma informed care approach, where this is helping them to reframe the behaviors instead of just reacting to the behaviors or not thinking or blaming them that is their problem, they are bad, but instead understanding the coping mechanism, survival mechanism the nervous system is operating on with their reactions, and to understand that there is other ways where you can regulate your emotion in a better way. So there comes your mindfulness, asking about your questioning patterns. What are you noticing right now in your body or in your breath? So whenever the body and breath is working, the mind is actually interacting with that and telling your body, oh, my body is reacting with that anger or shame, which is not actually something which you're shouting at a person, yelling at a person, or not engaging or using cursing words more often. These are all the patterns of trauma what the person have been undergoing and their previous past experiences. So that has been registered in their body and the way they react to the human or the care. So the grounding question for them is, what are you noticing right now in your body or in your breath? And so that they have their present moment check. What just happened inside when I said that? And then observe, curious observation comes. I notice you just paused. What was that like for you? So these are some of the examples I put on the slide. So you can frame your question in a better way, whatever you think of. But these are the basics of how you can actually question and get that person open to engage with you. So education is very, very key. And when you're able to understand what's happening inside you, that is actually helping them to reason out. And then I'm making sense of the other emotional regulations, what is going to help them down the line. So it is very key that how you're transferring your knowledge into your practice mindfully. So now we have spoken about that window of tolerance. So how we are going to bring that person into the window of tolerance is very, very key. So you need to having these three steps of repetition. That is, you're setting up that boundary consistently, and also trying to reinforce healthy behaviors in your practice, like breath work or mind body practices, which I'll be discussing later on. But some of the key strategies that can help them in their regulation of their neural pathways. And then the next step is about the skill building. That is how the client can be equipped with this toolkit of coping strategies. Talking from my chronic respiratory rehab had that is very key in that population where people just actually coming to the rehab program and then engaging with the exercise or physical activity is not building their coping skills to the trauma, which is actually interacting and not helping them to engage with the services in a healthy way. So that's very, very key. That's what we are focusing on in our rehabilitation and in incorporating this trauma-informed approach in our rehab practices is a very key to develop that coping skills in our patients. And the next level is about the increased tolerance. The clients remain present with more distress without losing regulation. So it is about how you can increase the window of tolerance of regulated presence. That is very, very key in your practice of helping the people getting engaged with your service. So regulation is the foundation of all trauma work. So clients must be able to stay present and manage emotions and body sensations before they can process and begin to respond in a healthy way. Now, I mentioned about using developing their skills. How you're going to develop the skills? We are more familiar with the cognitive behavioral therapy if you're a therapist in the practice, or if you're a client, you might have been taking some sessions with your therapist. So you're familiar with this cognitive behavioral therapy method. It's about trying to understand what is happening inside your brain and why your behavior is like that, and why your thinking process is making that behavior to happen, and what you can reframe to help to regulate your emotions to change your behavior. So that's something it is about thinking and your behavior connection is all about the cognitive behavior therapy. And so incorporating the trauma informed approach in that the way you format your questioning to your clients and not re-triggering the trauma which already happened inside them is a very, very key. And your questioning should not be intriguing, that is, creating them to question themselves, their validity, but in a way, in an open space where they feel supported and you're there to help, and your only intention is to help them and also to make them understand why those responses are happening inside them. So that's very key part of the cognitive behavior therapy, incorporating the trauma informed approach. And somatic therapy, body-based processing and nervous system regulation. There are different forms of somatic breath works and somatic dance and everything that is going to help you for the body processing and the release of that tension from your body. That is forming the somatic therapy. And eye movement desensitization therapy, that is also EMDR, is also very, very key part of this trauma treatment. It is about the bilateral stimulation of your eyes. There's movement of the eye movement is focusing on one direction and the bilateral movement simultaneously. That is going to help you to target on the traumatic memory and restructure, reframe that traumatic memory. There are several stages in that. I've been certified in the EMDR as well. So that is also working, having greater positive effects in the patients with trauma or episodes of depression. So that's some part of the therapy you can incorporate in your work. And the mindful presence is a very, very key. So when you're talking to your client, not taking some notes, but more focusing on maintaining that relevant eye contact. It's not about staring at your client always, but it's having that relevant eye contact and then having that time to getting the consent or informing your client that you're taking some notes, and so that they're aware that you are not making that contact and you're involved in helping them and they wanted to make some notes for them. So that's something about the mindful presence, what you should be incorporating in your practice as well. And the mindfulness, there is a lot of forms of breath works with the mindfulness as well. So that's something which you can choose to incorporate in your trauma informed approach in your practice. So these are some of the ingredients of mind body integration in trauma care, where you can incorporate in your practice, and this goes by stage, and you can actually structure design in your interaction, because the first interaction with your client is all about understanding them and making them to realize that whether you are going to be their therapist and be helpful to them. So trying to own up that whether your skill sets are going to tailor the needs of trauma care. So that would be your first interaction with your client. And then later on, trying to build the structure by the end of your first session or second session, build up a structure or a plan how your therapy is going to be. What are the key ingredients you're incorporating for that 6 weeks or 12 weeks therapy program. Some complex trauma, PTSD, might take 3 months or 6 months even to work with your therapist to get that healing happening inside you. And as I already mentioned, the trauma informed approaches in the workplaces is something that you can follow the principles, 6 principles, which I've stated earlier in this webinar, and telling that the agreement with your employee or the vendor agreement or the funding agreement in your healthcare setting. So incorporating the trauma principles is 6 principles is the key in a trauma informed approach. So to summarize, so applying your trauma-informed practice, working in the present, focusing on the current experience, not the past events, and although the making sense of the past experience and making them understand why it happened, why your body reacted is a key part initially, but but on a repeated basis, not to trigger those past events again and again. Although during the exposure therapy, we do actually have bring in that small element of the past experience in the each of the therapy session, and make helping them to make meaning of why those reactions happen. But it is not to go to deepen or re-trigger the trauma. And so becoming more mindful and sensible of how your client is reacting is very, very key for healing. And then creating a safety in your practice, very, very, very key. And safety comes with your integrity and how your client senses your integrity, and your consistent boundaries with them, and how clearly you state and communicate those to your clients, very, very important. And also here comes the cultural awareness as well. So different cultural practices or cultures have different ways of understanding this safety. So you need to invest in what is that cultural identity the person is owning up, and so how you can interact with them and communicate the safety and boundaries with them is a key in your practice. And supporting choice and collaboration, among the six principles you might recollect, I mentioned this. So offering choices whenever possible, even small ones, that restore the agency, and encouraging the active participation in the goal setting and planning, involving the client, and or the patient in your planning is very, very key. So co-production of your treatment care is very key for the engagement. And so respecting the autonomy and then working with, not on the client. So not pointing them or blaming, but just making them understand what is happening inside them. And it is actually relieving them from the shame and guilt mainly, and making them to get involved that in a healthy practice way, a trauma informed way, to engage them in the service. And finally, the boundaries. So clear professional roles, and avoiding over involvement. So when you're interacting, it's very easy, as you're also human, to get more deeper into their traumatic events, and that might actually re-trigger the trauma, and that might actually make them disengage with you or the services. So try to not over involve, or try to not create an impression that you're going to rescue the client, but it is about the client who's making the change, putting the ownership on them, and so that they can empower the strategies, whatever you're helping them with. So you're acting as a facilitator here, not as a rescuer to the client. And so providing a structure and consistency. So boundaries are themselves a form of safety. So that's something which you need to remember. And it is very important part that the practitioner well-being. So practitioners go through this compassionate fatigue burnout. So it is very key that you save yourself from the burnout and the prolonged exposure to the traumas from your clients and compassionate fatigue. You have these strategies there, having a regular supervision and reflection, like using journaling or peer consultation or debriefing, and self-regulation. So you practicing your own way of trauma informed approaches, and that's something like the breath work or somatic release, or interacting with developing your knowledge, interacting with the materials that is going to develop your practice. So that's something which will help your brain to understand that these are something which is happening with your client, and these are also something which you might have experienced in your life, and how you're making the meaning, and how you can help the client if you're making a healthy way meaning making, then how you can help the client to do that. So that's something which is very key part of your protective strategy, self-regulation. Now, so the key takeaways of trauma-informed practice, number one is complex trauma affects body, brain, and relationship. So its impact is pervasive. So assessment and intervention should be a holistic approach. Number two, regulations comes before processing. So you have the safety and stabilization, the first stage of the trauma treatment, before the trauma material is approached. And number three, healing is integrative and relational. So effective care balances cognitive, somatic, and relational approaches. Number four, practitioners must remain regulated. Because as humans, we need to regulate our emotion while you're interacting with a client to create that safe boundaries as well. So our own nervous system regulation is a clinical instrument and a professional obligation. So now we come to the slide of reflection, close to the end. I want you to take a moment to reflect on these two important questions. What is one trauma informed change you will make in your practice starting from this week? And how can you bring more safety and genuine curiosity into your daily interactions with the client? So these are two important questions I would like you to reflect on for 30 seconds now. Now let's move on to your final slide. So thank you for your engagement for this. So I want you to ask what questions have come up for you about the content what I shared today with you, and how would you going to apply on a daily practice. And if you have any questions, you can drop those questions to my email, sdevi@therapies.org. And also the reflection questions, which I put on earlier, is a better way to reflect on the session. And what resonated most or challenged your existing understanding is something I would be more interested to understand. So that will help me to deliver this future session in a better way. So I want your feedback. And also, how does this framework connect with your current client work? Something I would also be interested to understand. And I'm developing this a CPD program, a 2-day training program of trauma informed approach for healthcare professional, and which this material forms a part of it. And if you have any suggestions that I can improve on this material, please do connect with me, and I can actually collaborate with you if you're interested also to contribute your expertise to this work. I'm more welcome as well. So do contact me if you have any thoughts on this. So with that being said, thank you for your engagement. If you're staying until the end of this webinar, and if you're rewatching this as a recorded session, thank you again for your engagement. And I would love to connect with you. Have a good day, and I'll see you in my next webinar. Thank you. Bye now.